Okay, so today we're going to be doing our head-to-toe assessment. Here's my cheat sheet. Okay, so first thing you're going to do when you come in is you're going to knock, and then you're going to give your patient your name, your occupation, what you're going to be doing today, and then we're going to do our two-patient verifier using our patient's name and date of birth. We're going to ask our patient if they have any allergies. Do you have any allergies? No. And then we are going to just make sure our patient knows that, where they are, like their level of consciousness. We're going to check and see if our patient's call light is near them, if their bed rails are up, and if their bed level is the correct height. Next, we're going to do our vital signs, and that includes blood pressure, pulse, temperature, sometimes pulse ox. If that's all normal, we're going to move on to pain. We're going to do our PQRST. We're going to ask what provokes their pain, what quality their pain is, if it radiates, how severe it is, and the time, so like how long it generally lasts. Next, we are going to do our neuros. So again, we're just going to make sure our patient, or we're going to check our patient's level of consciousness. Do you know where you are? Do you know what day it is? Okay. And then we are going to we're going to have them push down or grab our hands as tight as they can. Boom. Push on our hands with their legs as much as they can. We're going to check pupils with a pen light, just make sure they're reactive. Then we are going to just make sure they're not slurring their speech. We're going to make sure they have a good facial symmetry, there's no drooping or anything. Then we're going to move on to our respiratory. We're going to make sure our patient's taking nice deep breaths, so can you breathe in for me? Okay. Have our patient cough. Was there any mucus produced with that?
Mm-mm.
And then we are going to listen to our patient's lung sounds. So we're going to start in our upper lobe on our right side to go across to our left. And we go down to our right lower and go across to our left lower. We're also going to check if our patient is on oxygen, and if they are, we're just going to double check the amount of oxygen they're on, check the tubing, and we're going to check their O2 stats. Now, next we are on cardio. Cardio, we're going to check their rhythm and their heart sounds. So, heart sounds. First, we have our aortic right here in our right second intercostal space. And then we have our pulmonic, and that is our second intercostal space on our left side. And then we have our Erb's point, third intercostal space on the left side still. Then we have our tricuspid, which is fourth intercostal space, and then mitral, which is our fifth. And then we're going to check our patient's capillary refill. So we're just going to push on the nail bed and make sure it turns back. And then we're going to ask our patient if they themselves have experienced any edema, and then we're just going to double check on our lower extremities just to make sure our patient isn't retaining a lot of fluid. Okay. And then we're going to check our patient's carotid pulse, our patient's radial pulse, and our patient's pedal pulse. Okay, and then next we have our gastro. So we're going to ask our patient, when was the last time you voided?
Yes.
Yesterday. Do you have any pain or tenderness in your abdomen?
Nope.
When we listen to our patients' GI sounds, we're going to start in our right lower quadrant of the stomach, go up to our left or our right upper quadrant, go across the middle, do left upper quadrant, left lower quadrant. And then we are going to ask if they have any scars on their stomach.
Nope.
No. Then next we have our integumentary. So we're just going to check our patient's skin color, their temperature, their tuger, and then we are also going to check our patient's mouth, make sure it's not dry, make sure there's no sores or anything. We're just going to check over, see if they have any wounds, also ask them if there's any wounds we can't see.
No.
Next, we have our musculoskeletal. We're going to do some range of motion, so we're just going to have them do a little bit of exercise, make sure everything's okay. Do your leg for me. Okay, and then wrist. Okay, then we're going to check our patient's muscle tone, and then we are going to ask them if they use any assistive devices.
Nope.
No. Do you have anything holding you back from doing your regular daily routines?
Nope.
No? Okay. We're also going to ask the client if they are unsteady when they're walking, check their gait, maybe have them walk for you. And then lastly, we are going to do our IV lines, if our patient has them. If they do have them, we're going to check the site, make sure it's not red, hot, anything. And then we're also going to check the IV tubing itself, making sure it's not kinked, making sure it is not wrapped around anything, and then we're going to check our IV bag and make sure it's the correct medicine hanging.